Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Scottsdale Airport, which is the second busiest single runway airport in the country. Over 200,000 flights come in and out of the airport each year, and the airport itself brings in about $182 million of revenue annually. The airport was developed in the 1940s as a training facility for World War II pilots. It continued as a training facility, and the city picked it up in 1960s, and they ended up adding in thousands of acres and calling it the Scottsdale Air Park. So now it's home to over 25 national and regional businesses, along with over 2,500 small to medium-sized businesses, and the cumulative economic input from those is about $3 billion a year. So it's a pretty impressive slice of real estate up here in Scottsdale. The topic for today is manipulation under anesthesia. Manipulation under anesthesia, or MUA as it's commonly referred, is a procedure that has gotten more and more popular over the last decade for a lot of musculoskeletal conditions, such as frozen shoulder, a stiff knee replacement, stiff knee after a knee replacement, painful low back, pelvis, stiff and painful neck, a lot of issues with the spine as well as extremities that are not resolving with conservative treatment. If you put a patient through, some interventional pain treatments, physical therapy, chiropractic manipulation, sort of a realm, maybe some acupuncture, and it's not quite cutting it, then MUA should be considered as a potential treatment to get better. And here's the way that it works. Let's say that a patient has a frozen shoulder and they've tried multiple, injections, physical therapy, some injections in and around the shoulder, and it's just not getting better, even with the tincture of time. Well, what's the answer? An MUA can help tremendously. The patient goes into an outpatient surgery center. They go under twilight anesthesia, which is basically IV sedation. They don't have to be put out completely, just enough so that they're not cognizant of what's really going on. And two doctors manipulate the shoulder joint in a very controlled manner past the normal range of motion they're able to get in physical therapy. So that will break up scar tissue, increase range of motion, but not break bones. So you want to be careful about that. That's why there's two doctors. One helps hold the patient still, and the other one sort of in a controlled manner rotates the joint, whether it's the pelvis or if this condition we're talking about the shoulder, so that it can get more range of motion. It's usually done on a repetitive fashion, 3 days in a row. And the two doctors, it might be a chiropractor and an MD, it may be a DO and an MD. It's going to vary depending on which specialty is under the patient's care. It may be a patient who had a knee replacement 6 weeks ago, is not quite getting the range of motion that they should be getting. So to try and jumpstart the patient's physical therapy again, they may have a manipulation under anesthesia. And then it could be where that patient gets admitted to the hospital for a couple days with an epidural catheter in place. So they have one of those machines that helps continually manipulate the knee. Or, it could be a patient who goes home that night and comes back the next day. So MUA has been shown in numerous studies to have very good outcomes. Patients at a year's point in time have a minimum of 70% good to excellent results. It's non-invasive, so you're not putting in implants or doing big-time incisions. These are really no incisions. It's just anesthesia. You have the controlled manipulation, and then you go home. So the complication profile is low. Anytime you go under anesthesia, there can be an issue. If you have questionable bone quality, you could end up with a fracture. Very low occurrence of that happening. The biggest risk is probably that the pain will not be completely relieved. What happens is after you get the 3 manipulations, patients continue to come into the rehab center regularly to make sure that they keep the newfound range of motion. A lot of patients are sore after the procedure, but that goes away within a few days to a week. And then after the couple weeks, the range of motion that they got that's anew is continued and maintained. So it works very well. There's plenty of information on our website about it at preferredpaincenter.com. Also call us for an initial consultation at 602-507-6550. Our chiropractor was Best Chiropractor in Phoenix 2010. He's certified in manipulation under anesthesia with special training in it. I'm Dr. David Greene, CEO of Preferred Pain Center. Your pain stops here.